Good afternoon. On behalf of Chairman Rand, Zimmerman, and Krug, I'd like to thank everyone for joining us for this afternoon's briefing. As we realize over 12,000 COVID cases statewide, we're beginning to see increasing numbers in our area. We want to urge everyone that has been vigilant about the stay-in-place and social distancing procedures to keep it up. For those who thought it was a joke, it's time to wake up and realize what's happening. This is very real. We're fortunate that we began the social distancing early. I cannot begin to emphasize how important this will be to keep our infected numbers as low as possible. Please, if you don't have to go out, don't go out. If you can work from home, please do so. Reduce all contact as much as you can. We've spoken in the past that COVID is an equal opportunity virus. In the beginning, it was suggested it may not have a big impact on the younger generation. This has been proven wrong. There are also numbers coming out at the state level that would indicate that African American communities may be at a higher risk for a number of reasons. Perhaps some may not be getting this information, depending on where they source and prioritize their news. Systematic medical realities facing minority communities could be providing increased susceptibility to the COVID disease as well. Please help us get this information out to everyone. Make no mistake, we all need to be vigilant, and we must also make sure that all members of our community understand the importance of social distancing at this very critical time. Last week, I asked the business community to take extra steps to improve safety for their employees and their customers, and I'm happy to say that many have done so, and we thank them. Just today, the Kroger companies announced the adoption of customer capacity limits in their stores to further encourage physical distancing. Beginning tomorrow, Kroger's will begin to limit the number of customers to 50% of the building code capacity in every store. This, in addition to plexiglass partitions and educational floor decals that Kroger and many other local retailers have employed to encourage customers to practice good hygiene and spatial awareness. We know that many of our local businesses are doing a very good job to keep their employees and their customers safe. Thank you. Please keep it up. We all need to do our part to stay ahead of the steep COVID curve. And in fact, we do our best to shave that curve down. All of our lives depend on this. The more we do to take the stress off of our hospitals and frontline medical professionals, the safer they'll be and the safer that we'll be. Now I'd like to introduce Monica Hendrickson.
Thank you, Mayor Artis. Today's count to date, there are 32 confirmed cases in the Tri-County region, 12 in Peoria County, which is an increase of 1 reported yesterday, 14 in Tazewell County, which is an increase by 1, and 6 in Woodford County, which is the same as the previous day. We are reporting 2 deaths to date in the Tri-County region, 1 reported yesterday for Peoria County, and 1 for Tazewell County reported today, who is a male in their 80s.
When? Male in what?
In the 80s. Hospital data includes 20 total ICU bed usage between individuals that are under investigation for COVID, as well as confirmed cases of COVID, and 31 non-ICU beds for both persons under investigation and those confirmed with COVID. I'd like to introduce Sarah Sparkman, the Communications Manager for Tazewell County Health Department.
Good afternoon. Among the Tri-County cases are 4 confirmed and 2 pending at a Tazewell County long-term care facility. The cases at this facility are residents and are hospitalized. This facility has been in regular communication with the Illinois Department of Public Health, the Center for Disease Control, and Tazewell County Health Department. Access to the home has been strictly limited to essential healthcare workers since IDPH issued their first order to limit access on March 13th. This facility is adequately stocked with personal protective equipment, and all employees use PPE as required. Residents have been following strict isolation procedures since the first resident has been symptomatic. Residents in nursing homes are our most Residents in nursing homes are our most vulnerable and valuable population, and we are doing everything we can in cooperation with our long-term care community to protect them. Tazewell County Health Department has been in weekly contact with long-term care facilities in Tazewell County, offering guidance and processing requests for personal protective equipment as needed. I feel also, though, it is important, like Mayor Artis said, that 2 cases that we reported over the weekend, one person is in their 50s and another is in their 30s. So this is not all older population. It is affecting the younger population as well. And these are also community transmissions. So they did not have contact with a person who has been confirmed. It was community acquired. So that's something else to note. And I'll turn it back to Monica.
Thank you, Sarah. We'll open it up for questions.
I have a question for Sarah. Can you share any more details as to which facility is this? I think, loved ones hear that who may not be the immediate family and may want to know.
I can't share that at this time. We can, if there's questions about a specific facility, I could confirm or deny that.
So what you were saying is that this man lived in what you were calling a long-term care?
I'm sorry?
Death, you're saying lived in the long-term care?
The gentleman was,
facility?
yes, the gentleman was.
What exactly is a long-term care?
Could be a nursing home. I mean, common terms are nursing homes, assisted living, those types of facilities.
And when did this man die?
Today.
So it would have been this morning or this afternoon prior to this.
Correct.
Had he been in the hospital?
Yes, he was hospitalized.
Was he in the ICU?
I do not know that. All I know is that he was hospitalized.
Sarah, are you able to say his age or anything like that?
He was in his 80s.
80s, thank you.
So when we're talking about specific facilities, like down in Christian County, for instance, like they've released the names of specific facilities where these deaths have occurred. Why is the policy different here?
I spoke to our lead at Illinois Department of Public Health, and they are encouraging us just to confirm the name of the facility.
Did they give a rationale as to why they want that policy?
Not to me, they did not.
Can they do anything to assure that no one else will die in this facility?
Everyone in that facility is still in the people that are confirmed cases are hospitalized. The residents who are still in the facility are isolated to their rooms.
Can you confirm that it was Generations Riverview in East Peoria?
I can.
And how many of those cases were in there?
All of them are in that. The 4 confirmed and 2 pending are from that facility.
And then what do we know about in terms of healthcare workers that come into these facilities that, may, interact with one person and be going kind of from room to room? Kind of how we handle that?
I can answer that, Sarah.
Okay, thank you.
So the question was specifically around healthcare workers that work in these facilities. So early on, the guidance from the Illinois Department of Public Health that really was based out of information gathered from Washington State was recognizing the fact that our long-term care facilities, especially their workers and their frontline staff, often have multiple jobs at different facilities. So a lot of it was educating entities about understanding the risks of their staff working at different locations, as well as doing screen measures. So prior to coming in for shift, checking their vitals, checking their temperatures, their symptoms. During their shift, doing multiple also checks as well. And what makes this really imperative is also understanding the fact that As we've progressed through this response, not only in our country but even internationally, we're recognizing the fact that people can be asymptomatic and be carriers of this. So again, doing that due diligence and understanding that exposure and those interventions of social distancing, hygiene, all of those are going to be imperative, because it's no longer just someone being symptomatic that is spreading this, but individuals that are asymptomatic can also be spreading this. And I think in regards to your question previously about the sharing of information and kind of the differences, our previous one that we had here in Peoria County, one of the reasons why we did not release the name of the entity immediately was because that agency was notifying all their staff and residents as well as family members to make sure that information was properly notified to them prior to release for information, as well as making sure we had a key contact to answer questions specifically about that establishment. We didn't want to provide any guesses to what you might have had questions about, and so we wanted to make sure that we were giving you the proper information about who can answer those questions in terms of that long-term care facility.
So is that going to continue to be policy in Peoria County, or are you going to adopt a similar one to Tazewell?
We will, if we are asked a question about whether or not we know the name of it and confirm it, we would work through that process. But really, our primary aspect is making sure that once we know a long-term care facility has been identified, we begin contact tracing and working with them to notify all their participants. That's our first and foremost priority as a health department.
So then I know, especially in terms of hospitals and stuff, kind of restrictions have, either progressed or changed. And a lot of time we say, if it's end-of-life care, sometimes there's exceptions. And obviously when we're looking at these kind of facilities, unfortunately this is sometimes the situation. How are we handling that in terms of, trying to keep people safe in and outside of the facility when that's the situation?
So the question really being, during those end-of-life care issues, are there any variances to how we deal with some of the visitor restrictions or isolations? And all of our long-term care facilities adopted similar to the healthcare providers in terms of understanding that if it's end-of-life issues, what they are able to provide and support. It is a very difficult decision, especially when they are in extreme policies such as lockdown. Our own facility here in Peoria, as well as in Tazewell, is putting really heavy restrictions, only essential personnel. And that's why we communicate with the families so they understand that based on the changes because of a positive test or of an outbreak status, that they're going to now be on a further restriction with their loved ones, and what does that mean, and how they can properly get coordinated information from them.
I know Generations at Riverview was just mentioned. Did Ms. Sparkman say that she can confirm or could not confirm it?
She did confirm it.
She confirmed that? Okay, thank you.
And how many residents and how many staff total at that facility? That's positive?
After the press briefing is over, we can send out the information for the contact person for Generations at Riverview, and he can answer those kinds of questions for you about the staff and numbers that are in the facility.
Well, but what I think that he asked is, how many folks have tested positive of the staff, and how many people have tested positive as the patient or the resident?
Okay, so what I had stated earlier was we have 4 residents that are confirmed positive, and we have two residents that are pending tests.
So that means there are no staff.
Not that I'm aware of at this time.
All right.
Question from Monica. So now we know that you can get COVID-19 from either just talking, someone breathing. There are clearly a shortage of masks, even for medical professionals. What do you suggest to the people in the community when you see people with scarves on their faces? I've even seen people with birthday hats around their faces. And, I don't know if that's right or wrong, but I don't know if that's the proper thing to put around your face to protect you from COVID-19. What are you suggesting to these people when there's already a shortage of masks out there? What should they buy, or should they just go maskless?
So the question is, in terms of for the general public that might not be able to access PPE, specifically masks, what they can do. The Centers for Disease Control and Prevention, or the CDC, as well as the governor, did make recommendations for individuals to make masks or use cloth masks as a way to, again, control the spread of transmission. Now, again, wanting to make sure everyone still understands that this is still a droplet-based virus. So unlike measles, which is airborne, because it's droplet, there is a distance and a radius around an individual that's really kind of that hot zone, so to speak. That's why we always talk about that 6-foot distance. So when you are placed in situations such as going for your essential services, whether it's the pharmacy or the grocery store, using those type of masking, whether it's a scarf, cloth, or one of the ones kind of the directions that the CDC is offering. Those are all readily available and useful things to utilize if you are not able to get an N95 or another type of mask. Having said that, that's not the only thing you should be still doing. Practicing social distancing, good hygiene, those are always going to be those key interventions. It's not a one and done with just a face mask. It's multiple levels that you're going to be placing because there is no vaccine and there is no medication for this. And so again, those non-pharmaceutical interventions are going to be important.
So basically, if you don't have a mask, if you don't have the means to make a mask, you can still go out in public as long as you're keeping your distance?
If you're unable to make a mask out of a bandana or a piece of fabric at your home or a scarf and you don't have those materials, then yes, again, look at how you can limit your interactions and if you are unable to limit those interactions, practice that social distancing is imperative.
Monica,
In the ICU, what is the treatment process like for somebody who does have COVID-19? Are there any medications specifically being used in ICU?
So that really depends on the patient itself. And the question was, what kind of treatments are utilized within the ICU? This is a respiratory illness, and so a lot of it is making sure that you're getting the right amount of air into your system, right? But because of the comorbidities that can exacerbate this as well, there's a lot of things that our physicians, our medical staff are really working on. And so no two patients are alike, and we do know that there is some novel treatments in our area that are part of the FDA scientific research establishments, but those are not necessary for everyone, and it's going to be based on that individual and their care plan with their healthcare provider.
Monica, speaking of morbidities, we often speak about diabetes. Is there any indication of either type 1 or type 2 diabetes being worse for a patient, or and how does that impact them having worsened symptoms?
We talk about diabetes in general as a comorbidity, and that's a great question, is because diabetes in general changes your ability to fight off infections. And understanding that with the virus, there is ability to get secondary infections. And so really anyone that's diabetic naturally has the tendency not to be able to fight that off effectively. And so that's why it's a comorbidity and a high risk and making people vulnerable for this virus.
The White House is saying that this week could be on par with emotions such as 9/11 and Pearl Harbor. Our peak isn't projected until at least next week. Does that apply to us, what the White House is saying?
I think in general, the commentary of referring to this crisis to other crises, whether it was 9/11 or Pearl Harbor, just goes to kind of highlight the fact that as we talk about recovery, we are going to need to have a large discussion on resilience of a community and how we get through this process. It's going to change our dialogue and how we just accept norms. I think the thought process that we are going to go back to normal or back to exactly how we were before was not the case post Pearl Harbor and not the case post 9/11, to recognize that we are now creating a new norm in our communities.
People look at some of the cities being affected, like Detroit, New Jersey, New York, and say, those are big cities. This probably won't happen to me in my small city, in my rural community. What is your response to that?
I would say that currently in the Tri-County we have 32 confirmed cases and 2 deaths. It is everywhere.
This man who died, could you tell us what he died of? And what I mean by that is, obviously he happened to have had the virus, but do we know if he died of a pneumonia, a secondary infection, breathing, heart attack?
The health departments know that he had tested positive for COVID-19 and passed away. That information is really more directed to the medical community or the coroner.
So one thing Dr. Zige talked about today in the governor's press conference was starting to release zip code data for counties rather. Do you have any of that available at this time? Are you able to talk more about that?
We do have that data available. Our Peoria City County Health Department's take on that is we don't We understand that we are in a public health crisis, and we understand that individuals want to understand where this is. And to kind of refer back to my previous answer, it is throughout our community. We know we have community transmission. Having said that, we are going to be reporting that once we understand that the case counts are above 5, otherwise we consider it identifiable. And that's a standard we have amongst all diseases that we report as a state.
But as the governor mentioned today, and as the mayor alluded to in his initial comments, I mean, there are some communities, especially the African American community, that there are some, historic reasons why that may affect that community more than others, not necessarily biologically, but due to some societal factors. Can you talk a little bit more about that?
I can say that for Peoria County, our case count of confirmed cases mimics our demographic breakdown as a community. So we do not see an overrepresentation of one demographic versus another based on our local data. I won't go into the breakdown specifically from count by different race or zip code, and that's based on the fact that, again, they would be considered identifiable by our standard of 5 counts or less.
Going off of that, can you discuss, as Mayor Artis said, like we said, some communities are getting impacted more and may not be getting information from, necessarily us, the media. Can you talk about, steps you guys are taking to try to reach those at-risk communities that may not be getting information on a daily basis?
So when the Peoria City County Health Department, with coordination with the City of Peoria and the County of Peoria, determined to start our Emergency Operations Center, one of the key things we recognized was information. That's why we set up our Joint Information Center, or a JIC, to utilize all of our media capacity as well as yours. So thank you again for sharing these briefings to push that information out. I will say this, when it comes to health, even regardless if it's COVID or if it's maternal and child health or if it's heart disease or cancer, there are disparities in our communities, and that is why we want to make sure that our approach is equitable and what we are doing is targeted. A great example that Sharon Adams, the executive for Heartland, described was that Heartland is actually going to some of our high-risk vulnerable populations, those individuals living in shelters in congregate settings, to start assessing them sooner and earlier to get baseline data to monitor them. And that's what we're doing. We're wanting to make sure our response is going to be equitable because, as the mayor said, this is an equal opportunity virus.
Mount Sinai Health System may begin transfusing plasma from those who've recovered to patients who are critically ill with COVID-19. Do you know if that's something our local healthcare systems may begin doing?
They may begin doing that as this progresses. And I believe Mississippi Valley, the blood bank here, is actually asking individuals who've recovered from this to, based on a referral from their provider, can actually be a participant to donate plasma for this exact purpose.
I have a question for Mayor Artis. Hi. So we saw overseas that Boris Johnson unfortunately did get coronavirus and is in the ICU. Is there a plan locally if you happen to get the virus?
So the question was Boris Johnson's in ICU, and is there a plan if I get the virus? And I would say the plan is probably the same as everybody else. I don't think there's anything special in terms of the Peoria City Council.
Would anybody take over your spot, such as city manager or anything like that?
It would be an elected official that would take over. Yeah.
Who is the council pro tem?
We don't have a pro
I thought
tem
we
at this
did,
time.
under like Greaves, I thought we did.
Some have used it, yeah. We don't have an official mayor pro tem. We kind of rotate that around.
So who would it be?
Imagine that'd be if I was not available to participate in the discussion. I imagine that's a discussion that the council would have, and that they would
Okay.
have somebody do it.
I have a question. Nationally, they've released information where they're kind of limiting some of the restrictions that have, been in place for a really long time in terms of blood donations. Regarding the gay and bisexual community, can you talk a little bit about that, what you know about that, and again, reiterating the need for people to donate blood?
So the question is about the restrictions that some of our donations, especially blood donation, had previously, and that they're alleviating it as we're in the need. I think that highlight the fact of the matter is that there is a strong need for blood in our community and that donation. So if you are able to donate, please do. We really appreciate it. And I think in terms of looking at those restrictions, I think there are a lot of policies that are in place that during this process that we're going to see that we would like to keep that waivers in existence, whether it is specifically in regards to individuals that are identified as gay, bisexual, not being able to donate, or as the telehealth waivers. Those are things that are put into place and with time should be reflected and changed.
Dr. Greg Stoner answered this question at one point. You know, you say that there's certain criteria you need to meet in order to be tested. Is there a special stipulation for first responders, even if you are asymptomatic or you're not showing symptoms, you haven't been exposed per se? Are they able to get tested just because?
So in terms of our first responders and their ability to test, if they are symptomatic, they are actually one of our prioritized groups for testing, as well as there is a community-based testing center out in McLean County that individuals that are asymptomatic are able to go to and test. The key thing about testing and what makes testing viable is that symptoms would help you actually be able to diagnose it better. Our current testing requires people to have that symptomology to really get a positive or an appropriate positive or negative. So if you test too soon without symptoms there available, you might get false positive in those extreme cases. That's why it's really focused on symptomatic individuals getting tested. Now, having said that, some of the new testing that's looking at blood out in San Francisco, you don't necessarily have to have symptoms, and it can detect it while you're asymptomatic as well. But that is, again, in its initial FDA guidelines and being tested in a very specific area. So before I end today's remarks, I don't know if a lot of you know this, but today is actually National Public Health Week. Many people would not know that, but each year, the first full week of April focuses on the impact that public health has within our communities. This year's theme is looking back and moving forward, which seems really appropriate as we face one of our challenging public health crises of our lifetimes and still trying to work on improving the health of our communities. This week I will be highlighting those daily themes that make Public Health Week, and today's theme is mental health. The Partnership for a Healthy Community is a Tri-County Community Health Initiative, and we are focusing on mental health and substance use as two key priorities identified in our region for improved health. And this includes looking at a multi-sector approach to decrease depression, suicide, and drug-induced deaths. During this pandemic, we are keenly aware that our mental health is affecting our daily lives, with the anxiety and stress not only impacting the individuals, but their families, communities, and society as a whole. I again highly recommend individuals to visit Unity Place website for a comprehensive list of services, as well as 211 to get connected for support. Lastly, because this is Public Health Week and many of our staff are working from home or working in different situations, I would like to thank the incredible staff of the Peoria City County Health Department, the Tazewell County Health Department, the Woodford County Health Department, and actually all public health professionals out there. So thank you, and if you do have the chance this week, I hope you do reach out and appreciate a public health worker. Thank you.